If you want to predict how long someone will live, forget their cholesterol for a moment. Forget their weight. Look instead at their muscle. Muscle mass and strength are two of the strongest predictors of longevity that we have in medicine. And yet most people in their 30s and 40s give almost no thought to preserving them. My name is Dr. Victor Hayes. After years of clinical practice, I have noticed a pattern that is almost impossible to ignore. The patients who remain independent, who avoid disability, who recover quickly from illness, they share one thing. They are strong, not necessarily gym strong, functionally strong. They have muscle. And the patients who deteriorate fastest, who lose their independence, who end up in care facilities after a single fall, they lost their muscle years before they lost their health. Today I want to explain exactly why that happens and what you can do about it at any age. Let us start with when muscle loss actually begins, because for most people, it is earlier than they expect. After your mid-30s, you lose between 1 and 3% of your muscle mass every year if you do nothing to actively maintain it. That may not sound significant, but over decades, it compounds dramatically. By your 70s, if you have followed a sedentary path, you could have lost 40 to 50% of your total muscle mass. This is the condition called sarcopenia, and it is an independent risk factor for death. The research consistently shows that low muscle mass increases mortality risk by 2 to 5 times across different study populations. This is not because muscle loss causes one specific disease. It is because low muscle mass makes your body less resilient to almost everything. Infections, falls, metabolic disease, cardiovascular events. Your physiological reserve shrinks. Your capacity to absorb stress and recover from it diminishes. Think of muscle as your body's pension. The earlier you invest, and the more consistently you contribute, the more physiological reserve you can draw on when you need it most. Most people do not think about this in their 30s and 40s when they feel entirely fine. But the choices made in those decades directly determine independence and function in your 70s and 80s. Now let me explain why muscle loss does so much damage, because the most important mechanism is the one most people have never been told about. Muscle is your primary tool for blood sugar control. When you eat carbohydrates, your blood glucose rises and your body needs somewhere to put that glucose. Approximately 70 to 80% of post-meal glucose from your bloodstream is absorbed directly by your muscle tissue. Think about what happens when muscle mass declines. Fewer muscle cells, fewer glucose receptors, less capacity to absorb glucose from the blood. Your pancreas detects elevated blood sugar and releases more insulin to compensate. Over time, cells become less responsive to that insulin signal. Insulin resistance develops. And insulin resistance is the upstream driver of type 2 diabetes, cardiovascular disease, fatty liver disease, and numerous other chronic conditions. Muscle is essentially a metabolic buffer for your entire body. Every 10% increase in muscle mass is linked to meaningfully lower insulin resistance and lower diabetes risk. When you build muscle, you are building glucose storage and disposal capacity. You are giving your body more physiological room to handle the carbohydrates you eat without chronically elevating insulin. This holds true independent of body weight. Two people at the same weight, the one with more muscle and less fat will have dramatically better blood sugar control, better metabolic markers, and lower disease risk. Beyond glucose disposal, muscle determines your metabolic flexibility, your ability to switch efficiently between burning carbohydrates and burning fat, depending on what is available and what you are doing. Muscle tissue is dense with mitochondria, the cellular energy-producing structures. More muscle means more mitochondria, which means greater capacity for fat oxidation. You become better at burning stored fat for fuel. People with low muscle mass lose this flexibility. They become metabolically locked in glucose-dependent mode. They crash without frequent meals. They struggle to sustain energy between eating. They find weight management increasingly difficult regardless of dietary effort. A metabolically flexible person can skip a meal without crashing, exercise in a fasted state, and go several hours between eating without irritability or cognitive deterioration. These are signs of a well-functioning metabolic system, and muscle mass is central to achieving it. Now, to the most immediate danger of muscle loss in real-life clinical terms. Hip fractures, almost always the result of falls, carry a 20 to 30% one-year mortality rate in older adults. 1 in 3 people who sustain a hip fracture will not survive the following year. Even among survivors, many never regain their prior independence. The trajectory from the fracture goes: hospital, rehabilitation facility, permanent care. The difference between falling and not falling, between falling safely and breaking something, is often entirely determined by the strength of your legs and core. Strong quadriceps, strong glutes, good balance, and you can catch yourself. You stumble and recover. Someone with sarcopenia goes down hard. The same trip that causes a momentary stumble in a strong person causes a serious injury in a weak one. This is preventable, not theoretically, actually preventable, through the consistent maintenance of leg strength. Falls also create a vicious cycle that accelerates decline. After a fall, fear of falling develops. People move less. Moving less accelerates muscle loss. More muscle loss increases fall risk. Breaking this cycle requires deliberate, progressive strength training as part of regular life. Researchers have developed a simple clinical marker that captures overall muscular health with striking predictive accuracy. Grip strength, measured with a handheld dynamometer, which is essentially a device you squeeze, correlates remarkably well with total body strength and overall physiological health. Lower grip strength predicts heart attack, stroke, and early death across multiple large population studies. Many researchers now consider it as informative as blood pressure as a vital sign. Grip strength is not just a marker, though. It is modifiable. Training grip strength through farmer carries, walking while holding heavy weights in both hands, dead hangs from a bar, and resistance exercises improves not just grip, but overall upper body strength and functional capacity. Muscle also protects the brain in specific and well-characterized ways. Resistance training elevates BDNF, brain-derived neurotrophic factor, by amounts comparable to aerobic exercise. BDNF promotes neuroplasticity, supports the formation of new neural connections, and helps the brain resist age-related decline. Think of it as fertilizer for your neurons. Beyond BDNF, muscle tissue releases anti-inflammatory molecules called myokines when it contracts. These help regulate systemic inflammation throughout the body, including in the brain. Chronic low-grade inflammation is increasingly recognized as a major driver of cognitive decline and dementia. Building and maintaining muscle directly suppresses this inflammatory pathway. Emerging research also shows that people with higher muscle mass in midlife have lower rates of dementia decades later through multiple overlapping mechanisms: better glucose control, reduced inflammation, improved cerebral blood flow, and higher BDNF throughout life. The most important message in this entire video is this: it is never too late to start. Muscle responds to progressive overload at any age. Studies in people in their 80s and 90s consistently show significant muscle and strength gains in response to appropriate resistance training. Progressive overload simply means gradually increasing the challenge over time: more weight, more repetitions, or more difficulty. Your muscles adapt to the stress placed on them, regardless of your starting age. Protein intake becomes increasingly important as you get older because older adults are less efficient at using dietary protein to build muscle tissue. They need more to achieve the same result. A practical target is approximately 1.2 to 1.6 grams of protein per kilogram of body weight per day. A palm-sized portion of protein-rich food, meat, fish, eggs, dairy, legumes, at breakfast, lunch, and dinner covers this for most people without requiring precise tracking. Focus your training on the large muscle groups: legs, glutes, back, and chest. Squats, deadlifts, rows, and presses provide the highest metabolic and functional return on your investment. 2 to 3 focused resistance sessions per week is sufficient for meaningful progress, especially from a low starting point. Walking combined with resistance training is one of the most powerful combinations available for healthy aging. Walking maintains cardiovascular fitness and sustains general daily movement. Resistance training builds the muscle mass and strength that protect against falls, metabolic disease, functional decline, and cognitive deterioration. Together, they address almost every major driver of how people age. A simple, sustainable framework. Daily movement as non-negotiable. At least 30 minutes of brisk walking, taking stairs when available, and practicing getting up from the floor without using your arms. That last one is both a test and an exercise. If you cannot do it, Make it a priority to work toward. 2 to 3 resistance sessions per week. 15 to 25 minutes of body weight, dumbbell, or machine exercises targeting the major muscle groups. Include grip training. Farmer carries and dead hangs are exceptionally effective. Adequate protein at every meal. Consistency over intensity, always. A modest program followed for years will produce dramatically better outcomes than an intensive program you abandon after 3 months. Building muscle is like compound interest. The earlier you start, the larger the eventual payoff. But small deposits later in life still grow. The biology of muscle adaptation does not stop at any age. Strength is built slowly. The benefits compound for the rest of your life. Your muscles are waiting to respond. Start where you are and build from there. If this was useful, please subscribe to this channel and share it with someone who needs to hear it. I will see you in the next video.